This is Tom Lee, editor-in-chief of NEJM Catalyst, and I'm talking today with Eyal Zimlichman, Chief Transformation Officer and Chief Innovation Officer at Sheba Medical Center, the largest healthcare organization in Israel. Eyal is the leader of an extraordinary innovation center at Sheba, in my opinion, the most robust in the world of healthcare, and one that is being imitated and spreading. We're going to learn today about how this innovation center works and how it is spreading to other healthcare organizations in the world. Eyal, there is so much to talk about, and we only have about 20 minutes, so we're not going to be able to spend time on your remarkable personal story or even the evolution of the Innovation Center. Instead, we're going to focus on what it is today and how it works. So, can you give our audience a quick description of the ARC Center, which I understand stands for Accelerate, Redesign, Collaborate?
Sure. Thank you, Tom, and thank you very much for having me on this podcast. Well, ARC was built as an innovation platform at the core to answer for two important goals. One is to make sure that innovation actually drives real transformation on a large scale globally, to really be able to address the critical issues that healthcare is currently facing, such as workforce crisis, such as financial sustainability and environmental sustainability and others. And the second goal we've set to ourselves when we started was to make sure that as we go through these transformation efforts that are so much needed, to also make sure that innovation serves as an economic engine of growth. In many ways, shifting the paradigm from healthcare being a cost in many ways, or even a burden on some of the countries and societies around the world, to actually being an economic engine of growth, which is not often what we're seeing like, and not some of the capacity that healthcare is able to produce. This is what we said from the start. We then had to build a whole program in place that will be able to achieve these two goals, again, on a global scale. This was not intended only for Sheba Medical Center, but something to be expanded to create that global outreach, which it has reached today. We'll talk more about that. And to be able to reach this, we actually based ourselves on four fundamental principles. The first one being focusing on digital health solutions, where obviously we have huge amount of opportunities to really transform care. The second is turn our own institutions into engines of innovation, engines of entrepreneurship, to create the solutions from inside out and take them to the larger market that requires those solutions, using a lot of entrepreneurship training and culture change to make sure we're able to really react and come up with solutions, but also embrace and implement on a larger scale and drive change, which we know is very challenging. Create this through a global ecosystem where we all work together across 14 countries today, 35 healthcare systems, about 15 industry partners, and about 120 startup companies that all have the same aim to transform care. And finally, everything we've done, make sure we do this in a structured approach so that we're able to scale up relatively easy across the world through different cultures, regulations, and policies.
So you're incubating startups, and from having watched startups get started, including by my own daughter, I know that every one of them is like giving birth to a baby and then raising a child. So how many have you actually gotten underway in the last year or so?
So that's a great point. This is exactly what we're focused on. We're focused on taking those solutions to the market where they're very needed. Again, solutions that will help us get to where we need to be and solve the major crises that healthcare is facing. We started before we launched ARC with spinning out about 2 to 3 companies a year, which is pretty much normal with many academic medical centers. You know, we always see this as a bonus, never as our real aim in our profession. But through implementing the ARC methodologies, through implementing the culture change and the entrepreneurship training, in 2024, we were able to spin out 20 companies. 20 companies is really unmatched. No other hospital, as far as I know, around the world, or even universities that are spinning out 20 companies, all solutions to be used on the production floors of healthcare to improve care to our patients and solve, again, the major problems that we're facing.
So you're doing more than giving birth to one baby at a time. You're creating classes, or you're creating a mini Silicon Valley at Sheba and other places. Now, let's go a little deeper. What has been the focus for most of the companies that are emerging from ARC?
So a lot of these companies really handle and focus on where we need, which is to improve value, to improve outcomes, to improve patient safety and quality at a reduced cost. Many of these solutions are in many ways disruptive innovations, the way we've seen and spoke quite a bit about in the past, really driving real value at a lower cost. And this has been the focus, utilizing digital technology, which of course allows us that capability to really change how we provide care, to really handle, again, the care delivery aspects, and using the digital health to improve how we deliver care at a much lower cost. A lot are intended for the hospitals, and hospitals around the world are fairly similar. You go into one ED in the world, they're probably challenged with some of the same challenges that another ED has. So a solution for one ED would probably serve many other emergency departments around the world. This has been our concept, and the same for intensive care units, and the same for primary care clinics. So this is why working with frontline clinicians to pinpoint real world problems that production floor personnel are facing and patients are facing, to take that through digital health solutions to the real market and bring this to the broader global ecosystem.
So the clinicians out there are going to be interested in the value that your companies are creating, but knowing that a lot of CEOs and CFOs are going to read this transcript, tell us a little bit about the model. What does Sheba give financially and otherwise, and what does it get in return?
That's obviously a great question at the heart of everything we've built, because to make this viable, it needs to be financially viable, of course. It needs to be something where you see a return on investment for the organization, because otherwise we wouldn't be able to invest in such a huge endeavor. And this is how we've built ARC. We've built ARC in a fashion that we've grown with time. Now ARC at Sheba has 160 FTEs working, which makes us probably the largest innovation center in any hospital in the world. We started in 2019 with 20, which is fairly normal for many of the centers our size, but have grown with time as we've brought in more capital back into ARC and into Sheba. And that was in the shape of commercialization efforts. And those commercialization efforts have brought us to a point where we're completely self-sustainable today, paying salaries to 160 FTEs, and holding the activities that ARC is holding to get us to a point where we're continuously growing from year to year. I'll give you just an example from this past year in 2024. I mentioned already that we spun out 20 companies. On each one of those companies, they would be launched with an investment of about $2 to $3 million. It's not our own money. It's money we raise from partners around the world, and we manage funds from limited partners and others that work with us and are looking for good opportunities for investment. But we also sold two companies. Some of the early companies that we started about 10 or 8 years ago, we sold two companies, and those two exits that happened during the summer of 2024 have brought back substantial capital in the tens of millions of dollars that were then reinvested in continuously growing ARC and our capacity to innovate and transform healthcare. Specifically, in 2025, we used much of those earnings that we've made to establish and develop a new artificial intelligence center, hiring 60 more FTEs, top talent in artificial intelligence, which is a big effort we're doing right now to continuously grow the team, and really building a center that's focused on transforming the hospital environment and the health environment into an environment where AI has a substantial ability to really impact the way we're providing care. So this was seen through return on investment, through earnings we've made, through our own accomplishments with the discoveries we've done previously. And this is where the flywheel goes into the future.
Well, I'm delighted to know that ARC is working out so well for Sheba financially and otherwise. And I know that many organizations around the world have come to you over the last several years for help starting their own versions of ARC. How is that work going?
Yes, that's a major effort right now because of, first of all, ARC has created across the last couple of years, especially 5 years, quite a bit of evidence to show that it is a unique model, we were able to in many ways solve some of the challenges that others have tried. And I've seen many attempts in the past as well in the US, as well as other countries. And that's why there's a lot of attention that ARC is now receiving. That has brought us to actually partner with a consulting company, Deloitte, which I'm sure your listeners are very much familiar with, after an RFP process to find the best partner for setting this up. And we're now working with our partners to establish ARC centers around the world with many of the leading institutions. So this is something that leading institutions, many large academic centers, and also regional and national systems are actually looking to set up to achieve the transformation we're all looking to achieve, as well as the financial growth. And once the evidence was created, it became much more acceptable around the world to set up these ARC centers. So we're now in the process of setting this up in London and in Berlin and in Australia and New Zealand and Singapore and the US with several sites, as well as Canada with several sites and other countries in Europe. And this is where we see this now turn into an ecosystem of ARC sites that are working extremely close together to drive even further value to all these organizations, whether, again, they're academic medical centers, private hospitals, regional systems, or even national systems.
Now, I know that you have created more than a group of independent centers. They are actually a community. Now, what brings that community to life? What is making these ARC centers more than the sum of their parts?
So we put quite a bit of effort to coordinate and provide the services. We have our ARC Global Services Program, which basically, brings all these centers together to work together towards this aim of transforming healthcare. We know how challenging it is to transform healthcare. We know we need help. We know we need to work together. And we all have learnings, again, of things that have worked and things that have failed that would impact our chance to actually get this right and bring value to our patients. So this is what ARC Global Services is doing. We're bringing those centers together, those systems together. We're sharing best practices. We're sharing technology, not just the technology itself, but also implementation guidelines, implementation insights on where do we succeed on implementation, and also where do we fail on implementation. We all have a lot of stories in our background of perfect technology that has failed to create value because the implementation wasn't done right. And this is a critical part when we speak about healthcare systems, the diversity, the complexity of healthcare systems, the change management is something that requires us all to work together and learn from each other. So this is a living community sharing many of their projects, getting together virtually mostly, but also physically, at least once a year. We have an annual ARC Summit. We have regional ARC Summits, again, bringing people together for 2 or 3 days to share those best practices, to share technology where each spinning out and inventing. And this has major impact. And again, these are leading organizations from around the world. So this is something that I think as we look into the future, into this attempt we all share to transform healthcare, to think differently on how we better leverage the existing technology and artificial intelligence and so on to really be able to impact care in the way that provides the most value. The challenge that we're all facing will be solved in a much better format through global collaborations. And ARC is this platform, I would say unique platform, that allows this to happen.
I understand you have a leadership training program, and we may need you to come back to talk about that at greater length, but in just a couple of minutes, what are you doing and how is that going?
So apart from our entrepreneurship training, which is a school called Spark, of course, with a C at the end for ARC, which has now trained hundreds and more than 1,000 clinicians across the world with all of our sites, we also have a leadership training program. And this is an MBA program with the #1 business school in Israel. It's a global program, so it's open for folks that are coming from around the world. And within that program, we focus on healthcare innovation and transformation. So this is taking the business administration many of us are familiar with to really focus on how do we drive change, how do we make sure that we have the right leadership in place to make sure that this change takes place in a format that really would bring up the value that we're aiming to achieve. When we do this, it's a lot about sharing between not just the teachers, but also the students. It's a mid-career program, so people come from all over the world. A lot of sharing that happens between all of us, very, very diverse group of people, whether they're clinicians, but many of them are developers, are business people, are lawyers, engineers, and so on. And really, really doing hands-on some of this innovation and transformation that's required as part of the one-year program. So there's a lot of immersion that happens within ARC, and a lot of what's really the guts of how ARC works and how that transformation happens is being captured within that one-year program. We see already many of our alumni. This program started 8 years ago. Many of our alumni are leading such efforts around the world. And some of these ARC centers are being led by people that have graduated from this program. And we see this as another part in making sure we're able to drive change through leadership as well.
Well, Eyal, we're clearly just scratching the surface of this topic, and I know there's much more to come. You have already been such a great combination for healthcare of creativity and effectiveness, and I think you're taking it to some big new level internationally with this work. So I hope that you'll continue to keep bringing your work to NEJM Catalyst, and we will do our best to help our audience take full advantage of it.
Thank you very much, Tom, for having me again. And indeed, we look at the work with the Catalyst, which we use quite a bit to learn from as well as part of ARC, as central in all this effort. So thank you also, Tom, for the incredibly important work that you're doing.
It's a marriage made in heaven.
Thank you.